Hello and welcome. My name is Zaffar Iqbal and you're watching the Mojo Story. There has been an increase in COVID cases across India. India's COVID 19 case tally has increased by 8,813 in a day, on a single day. Now, Delhi registered 27 deaths due to COVID 19 in last 3 days, but the focus remains on things like masks to prevent the spread of the virus. Uh, Now, in Delhi, the government will again reportedly impose a mask mandate. Uh, People caught without wearing masks in public places will have to pay a fine of 500 rupees. The question that we are asking on the show today, shouldn't the COVID conversation right now focus on vaccines and whether vaccines should be given annually since protection is for 8 months or so? We joined by an eminent panel, Dr. Wasim Hanif from the University Hospital Birmingham, Dr. Rajeev uh, Jayadevan, who's the past president IMA, and Dr. Ishwar Gilada, infectious disease expert. Uh, if I can start with you, Dr. Gilada, how is the overall COVID situation in India right now? We've seen different phases. Sometimes the spike is up, sometimes it's low. But how is your generally the overall picture of the COVID situation in the country? If you can unmute.
Thank you very much, Jafar, for having me on the show. The overall picture about COVID in India is very good. It's not now, but it's for last 4 to 5 months or maybe 6 months. Whatever number of spikes you see, cases going up and down, that is bound to happen because we totally opened up. There is no masking anywhere. There is no social distancing anywhere. Programs are
Hmm.
going on, socialization, conferences, meetings, everything is going on, and that
Hmm.
work from home culture is back to office work. So under
Hmm.
this situation, cases will increase, but we should not be perturbed just by number of cases increasing. We should go by the trajectory of cases. What is happening after infection? How many of them require oxygen? How many of them require bed? How many of them require ICU or ventilator? And what is the death rate? What we have seen in last 5 to 6 months, the case fatality rate is 0.1%, which was cumulatively 1.3% for the entire country. Just in last 2 or 3 days, we are seeing the case fatality rate has gone to 0.3% rather than 0.1%. So I am rather bothered about this case fatality rate going up momentarily, though for just for 2 or 3 days, rather than cases of number going up.
Right.
Secondly, we should also compare what is happening in the rest of the world versus India.
Yeah. Yes.
Currently, rest of the world is reporting 50 to 60 lakh cases per week.
Hmm.
Japan is the highest reporting cases as a country, and that is almost 10 to 12 lakh per week. So, in that situation, Japan's population is so low than India. India, with 1.4 billion people, is reporting 20,000, 30,000 cases, not a big issue. And this 20,000 is not a real number also, because a lot of people are become smarter. They are not getting tests done. In a family of 4 or 5, if somebody has symptom, only one get tested. That too they don't report. We started already having antigen test, rapid antigen test at home. People are bringing, that is not reportable also. So even this 20, 30,000, maybe about 50,000, maybe about 1 lakh, but it is not so much. India's capacity to absorb even 4 lakh cases a day without having any kind of spike in hospitalization, we have seen in Omicron. What we should be bothered about is number one, whether the people with comorbidities, people with higher age, they are vaccinated fully. Fully means nowadays for them third dose also. So a lot of people are not taking third dose, and we should expedite that third dose vaccination. It
Okay.
will at some point of time start even an annual
Yeah.
vaccination, and we need
We
to
will
get
we'll,
into that. Yeah.
we'll talk about vaccinations, but Dr. Wasim Hanif, do you agree that India is in a better position compared to many countries in the rest of the world, given the population of India? There are other countries like Japan, as Dr. Gilada was pointing out, where the situation seems much worse than India.
Thank you very much, Safar, for having me on the program.
Yeah.
Now, I think we need to look at a kind of a perspective around what is the actual case numbers in any country. Now, in the UK, about 6 weeks ago, when the UK was having a spike in the number
Yes.
of COVID infections,
Yeah.
it was a very similar pattern to what we were seeing in India, where we had a huge spike in the number of cases, but the hospital admissions, IQ admissions,
Hmm.
and fortunately deaths remained very, very low.
Right.
Now, what Dr. Giladi has just mentioned was probably true in the UK as well. The number of people who were actually testing had gone down dramatically, and there was no legal requirement for actually wearing masks or social distancing and everything.
Yeah. Yeah.
Now, one of the best data that is collected, I think, globally is the ONS survey data, which
Right.
actually surveys for the number of cases of COVID. And the ONS survey data was showing that on a weekly basis, UK was reporting something around a million cases a week,
Hmm.
which was the highest in the first peak or the second peak.
Right.
So what we will be seeing is, and this is the nature of the beast, being a kind of a coronavirus, there is going to be spikes. Now,
Right.
what is actually perplexing the experts is, like with the flu, we see a spike during the winter months, and we're seeing a similar
Yeah.
spike in the winter months.
Right.
But what we are also seeing, as in the UK, as in India, is the spikes happening in the summer months when
Right.
people are not that much indoors, they are much more outdoors. So this is something we don't know, because in each of the cases you can actually see after the UK spike, be it the first wave, the second wave, and including that, about 6 to 8 weeks after that, India actually follows. This could be a slight different strain of the virus now, the B1,
Yeah.
B.125, or anything of this. So I think this is something we will all have to get used to living with it. And the good news, if there is a good news in the situation, is that the hospital admission rates, the strain on the health service, and the case fatality is low. But it is going to have a huge economic burden, because the number of hours that have been lost about people being not well, not coming to work, especially from the health service, is something
Right.
that the governments and policymakers will have to take into account when they'll start looking at the future economic growth, because all this is going to have an economic impact in terms of
Right.
international growth currently
Right.
in our economical crisis.
Right. Dr. Rajiv, how do you see the situation? Do you foresee another spike in India, as Dr. Wasim was saying, that a few months after there's a spike in the UK, we see some sort of spike taking place in India as well?
Certainly, as Dr. Hanif said, this virus is showing what is called a cyclical pattern as opposed to a seasonal pattern. A seasonal pattern is when a viral disease occurs during a season every year. But
Yeah.
COVID-19 or SARS-CoV-2 is showing a pattern where it enjoys a massive spread at unpredictable times of the year. The
Hmm.
only exception, perhaps, is in the Western nations, where there is there's a bit of a clustering around winter, and that might not necessarily because of a seasonal tendency. It might simply because people tend to gather indoors, and this virus loves indoor spaces, especially when people talk. So, from India's perspective, the cyclical trend is no doubt going to continue. And
Right.
right now, what we are seeing in India is what is called the grandsons and the granddaughters of Omicron. Omicron, remember,
Hmm.
arrived on the big
Hmm.
stage last November in
Hmm.
2021. And it is
Yeah.
still the Omicron sublineages that are circulating in India and also in the rest of the world. We have not seen a completely new variant yet. And we must keep in mind that a completely new variant does not come with alarm bells ringing. It may come as it might appear in some corner of the world. It will start as a tiny cluster, which is why we need to keep a constant vigil on what exactly is the phenotype, which basically
Yeah.
means what is the clinical picture of each one of these sub branches. Chances
Right.
are the sub branches might behave in the same fashion, if I may say that from experience with all the Omicron sublineages apart from some animal studies, there's really no big difference in the way it's clinically affecting people.
Yeah.
It's a whole lot different from Delta that we saw last year. It was complete
Yeah.
carnage around the world. But now we do not know if and when the next variant will arrive, which might have nothing to do with Omicron. So
Right.
that is the concern, and that is why
Yeah.
there is a need for vigilance. And there's definitely going to be multiple waves and multiple layers of prevention have to be continued, themed on what is called air hygiene. Remember,
Right.
we kept away many horrific diseases like cholera and typhoid by water hygiene.
Yeah.
What we
Yeah.
need for SARS-CoV-2 is air hygiene,
Yeah.
and it is no
Right.
single measure. This is not something you can take a
Yeah.
vaccine and forget about it. It's going to come after you, and it's going to come after entire population. So we need to. This is
Right.
a long fight. We have a long fight ahead.
Yeah, but granddaughters and grandsons of Omicron. That is a very interesting way to put it. But Dr. Gilada, do you think it's time to have an annual COVID vaccine program? Uh, because it's reported that after 8 months or so, its efficacy just goes away. So perhaps time to introduce that annual vaccination program.
You see, firstly, we go to efficacy. What we found
Yeah,
that efficacy of Indian vaccine, particularly Covishield, is far better and greater than mRNA vaccines, where their
yeah,
efficacy is only 4 months. Here, at least 7 to 8 months, people are having antibodies. Secondly, Omicron is now becoming like a flu. And if you compare the case fatality rate in flu and Omicron is almost the same. So possibly the vaccine industry should intervene at this stage and make a vaccine which is polyvalent. That means it will cover all variants. And secondly, they can make a vaccine which will be flu plus uh, COVID. So one vaccine can be given. It will cover all the seasonal flu which are there in this particular season and COVID, and that will be the system, or that will be this mode of vaccination, because a lot of people have been infected already. There is a very popular saying that 90% people are infected and 10% are telling lies. Almost 100%
mm,
people have been infected.
yeah,
So there is whatever is happening is a hybrid immunity. If you are
yeah,
taken vaccine, if you are not taken vaccine, is only natural immunity. Under this situation,
yes,
there'll be we are moving towards endemicity, and when we are moving towards endemicity, seasonally or annually, we need to take a vaccine, and that should be a course of action. If people
right,
take vaccine, they are better protected. If they are not taken vaccine, they're still protected, because when death rate or case fatality rate is low, I don't think it should be cause of concern for anything, and much less the requirement of compulsory masking or fining people or penalizing people. I don't think it is required. People in India are much better than rest of the world. They have been cooperating with the authorities. There are not big movements against vaccination. You go to many other countries. I have traveled at least 3 countries now in last 15-20 days. I have seen people are totally anti-vaxxers. A lot of people, they don't take vaccine. They don't allow others to take vaccine. In India, those who are not taking, they keep quiet. They don't make any kind
right.
of movement. So under that situation, putting any kind of penal action, fining
Will
people, making
will
something
not
compulsory is wrong. It's not going to
it,
work at
it
all.
it will not
It
serve
will
the purpose.
boomerang.
But a joint, you raised an important point. A joint vaccine for flu and COVID. We know that there are annual vaccines for flus administered uh, everywhere, and people really go for that. But Dr. Wasim, Hanif, would you agree with that?
Yeah, thank you. Yes, so I think the that is a very good suggestion that Dr. Gilead, and I actually there has been a work started on doing a joint vaccination, which is a joint of flu and COVID vaccine together. So the clinical trials have already started on that, and that will be good for two reasons. One is the convenience to the patient, and the second is the burden on the health services. Because you see, what we need to realize is that in the pandemic, the health service was really stretched in terms of providing services to the COVID patients. Now, if annually we have to do COVID vaccine along with the flu vaccine, that puts the strain on the health service. So if we have a combined vaccine, it works. But before that, I just wanted to make another important point, and this is something
Yeah.
which I'm asked by a lot of people globally wherever I go to speak, especially a lot of lay people. That is, we were told that when the vaccines come, once we have the vaccine, the 2 doses and the booster dose, we're not going to get this infection, but it'll keep on coming. So, what is the use of taking the vaccine?
Right.
Now, I tend to remind them that before actually the vaccines were discovered, there was an excellent review written in the Nature, which actually looked at the various scenarios for developing the COVID vaccine. We need to understand that the COVID virus is a coronavirus. So this is not like your diphtheria or chicken pox, which can be hit by single vaccines. Once you get it in life, chicken pox, you're never going to get it again. But coronavirus is the flu virus, which keeps on coming every year because it is able to mutate and things like that.
Yeah.
Now, the whole purpose of the vaccine from the beginning was to prevent deaths, was prevent ICU admissions, was to prevent hospital admissions. So when you talk about the efficacy of vaccine about 95%, that is what the vaccines were supposed to do it. And now we actually have seen that the natural pathogenesis of the COVID has actually changed. We are not seeing those kinds of hospitalization, not neither those kinds of deaths. But when it comes to the transmissibility of the virus, you're absolutely right. Any vaccine will only prevent you from getting a reinfection in 4 months, 6 months. There might be a slight variation depending upon your previous immunity. Now, the natural infections also contribute, but that immunity also goes down. Again, this is quite well documented in medicine. So now the question that we have
Yeah.
to ask is, because this is cyclical, if you're
Right.
going to give annual vaccines, is it going to work, or do you have to give it
Yeah.
biannually? That is going to
Yeah.
be quite a challenge. And the second
So
important point is, we don't need to give it to the entire population. We have to choose, as Dr.
yeah.
Giladi was saying, the vulnerable groups.
Vaccines have to be administered periodically. Dr. Rajeev, would you agree also, given the fact that, as Dr. Wasim Hanif was pointing out, that the virus mutates, all the more reason to have this annual or biannual vaccine program?
It's like this. What the vaccines that we have around the world, with the exception of the inactivated virus vaccines, are based on one part of the virus, which is called the spike protein. Now, the spike protein in itself is an enormous structure from a molecular viewpoint, of which only a few parts are being changed by the virus in an apparent attempt to escape human immune response. Now, the vaccines that are invented initially are based on what is called the ancestral strain, or the first strain of the virus. Now, the current strains of the virus are not completely different from what was circulating then. Some individuals are under the impression, especially who are not adept at science, are under the impression that this virus has changed from a car into a tractor. It has not done that. So that being said, the vaccines work against parts of the spike protein, some of which are immovable and some of which can be altered. Now, the ones that are altered, if that affects the quality of our immune response, then upgraded vaccines are needed. That's one aspect. The second is, do we need to periodically inject people with vaccine? Is a question that does not have a black and white answer. I'll explain why that is. When we reported the largest study from India, our group from Indian Medical Association, we reported the experience of 6,000 people across India in April of this year. We found that 15% of those who had been infected at least twice by then, and that was before BA2 sublineages had come, BA4 had come, BA5 had come. India had at least 2 or 3 minor waves after that. In other words, many more people have had natural infection. Now, the role of the vaccine, further dose of vaccine in someone that had 2 infections, is unknown. We simply do not know. That is uncharted territory. So I'd be cautious in treading uncharted territory, knowing that COVID-19 is an inflammatory disease, and vaccines are also known to provoke an inflammatory response. And they both can have adverse outcomes. Vaccines have rare adverse outcomes. So we must be a little cautious in endorsing a limitless pattern of repeat boosting strategies. But as
Yeah.
both the other doctors said, we must select the people who are at greatest risk and perhaps protect them with a greater degree of, let's say, vaccination. And people who are at much lower risk, we might want to leave them alone. So this is the instinct I have. As I mentioned, this is not a vaccine preventable disease at all. We have to
Yeah.
implement multiple layers of approaches.
So, Dr. Gilada, would you agree that we have to look at this vaccine thing with caution because it's going to come back? This vaccine protection will last for a few months, then obviously back to square one. Uh, so, what should be the priorities? On one hand, the focus is on masks, and on the other hand, we're talking about vaccines. Should there be a multi-pronged approach, or now it's time to really focus on selected, isolated areas and work on them rather than talking about mass and gatherings and all that?
You see, approach has to be always multi-pronged. Only one thing
Yeah.
will not work. So we started with SMS, social
Mm.
distancing, mask and sanitizer. Then we added SNS and V. So vaccine was added. But look at even if we say Omicron is highly infectious, if it is so highly infectious, you compare ourselves with that Delta period. How many people are
Mm.
getting infected? I
Yeah.
traveled and I didn't get infected. I mixed with people. Okay, what I would like to also say that you look at medical professionals, you look at hospitality industry. These are the two most honest mask users. You go to any medical establishment, any hospital, any clinic, they are masked. So that kind of culture has to be imbibed in people, that if you are going to travel in local buses, you want to go to theater, you want to enjoy life, you put mask when you are in a either closed door or in a crowded places. That is the only requirement. We are not asking people to be masked 24 by 7. We are not
Mm.
asking them to be masked in their family. We are not asking them to be masked in ground when they're playing. So if that much is followed, number one. Number two, look after elderly people, whether they are our parents, grandparents.
Mm.
Currently, 90% or more than 90% people who are dying, even in that 0.1% case fatality rate, they are the people which are above 60, above 70, sometimes above
Right.
90. So if we look after them, so vaccination is number one to prevent your own infection. Number two, to prevent the infection in those people which are not even vaccinated and they could be at home. Number
Mm.
three, preventing hospitalization and severe illness. And number four, preventing death. So all four things are there. People only look at, no, no, despite taking vaccine, I got infected. And therefore, people are spreading rumors that vaccine doesn't work. Actually, vaccine works. And that's the reason that India is saved today, because of 210 crore vaccines which are already pumped in. We are not getting severe illnesses at all. We are not getting deaths at all. Even those superstructure which are like a jumbo center, they are redundant. They should be dismantled as early as possible, because we are incurring a lot of unnecessary cost in that. Let us integrate entire COVID care into the general health care. If
But
for
should booster doses be made mandatory? Booster
no,
vaccine?
no, see, nothing should be made mandatory. You should
Yeah.
our strategy should be educating people that it is in your interest. It is in not my interest. So if somebody's interest is very limited, fine, you don't want to take. But you are at risking your children which are not vaccinated, because there are no guideline to vaccinate below 12 children. There are children which are below 5. There are elderly people above 60. There are people with comorbidities. And comorbidity is such a vague term that even hypertension is called comorbidity. So I will
Mm.
go severe comorbidities with the renal involvement, cancer patient, those which are on chemotherapy, those which are tuberculosis, those which are having asthma. So those people are more at risk. So I think we should look after them, and in their interest, even if you don't want to protect yourself, but at least for them, you protect yourself. And that much we have to tell. If the people don't want to take vaccine, fine. At least we are currently at that herd immunity level, that we vaccinated 70-80% population. Even children are
Okay.
getting
Yeah.
severe illness. Everybody talk that in the third phase or fourth phase we'll have a lot of children getting affected, infected, hospitalized. It has not happened. A lot of people started pediatric task forces. They started reserving beds in pediatric hospital, but it has not happened. So I think we
Right.
should go by this wiser counsel, and we should restrict our knowledge to this kind of thing and integrate COVID care into the general health care. Don't create vertical structure. They are superfluous and they are just time consuming, money consuming.
Right. Dr. Wasim, Hanif, what about increased testing? States like Maharashtra in India, which is seeing a COVID upsurge, the health officials are really putting focus on increased testing. Also, the fact that festival season is round the corner there. Do you think that is another aspect that need to be looked into?
You see, I think we have to really have a very mature, scientific, evidence-based conversation as to what the measures are going to going to work, and what measures are actually necessary. So one thing, anything mandatory is out. So you see, you can't keep on telling people to wear masks. We don't tell people not to eat fat food. I mean, in the chronologists by the day, we don't find people for eating sugar. So it has to be mandatory. That's the first thing. And the governments across the globe have to realize that. In the UK, it's up to the individuals to assess their own risk. The second important thing is we need to ask ourselves, what we are fighting against. What we are fighting against in terms of surveillance is for new mutations, so that we are ready. That if there is a huge mutation that causes a shift in the illness, which is unlikely, we are prepared. We don't need screening to tell people how many are infected. We will know then. Anybody who's got a temperature, sore throat, and headache has got COVID today, unless and until proven otherwise. More testing actually puts more pressure on the healthcare system. Third is, when we tell to people, you have got COVID, you need to isolate. We don't need to do that anymore, because almost everybody has had an infection. So it's no longer an epidemic what it used to be. It's now a pandemic, as Dr. Gilada said, with 90% immunity. And those are the conversations that the government have to have. But the important thing is there is a vulnerable group of people amongst us with chronic medical conditions. These are the group of people. In our hospitals, the only people who are dying or going into ITU have got underlying medical conditions. There will be one or two, but you cannot make a population-based measures for one or two people. You have to make it for the whole population. That is the challenge. So anything mandatory is out.
Dr. Rajeev, anything mandatory is out. Would you agree? And also about this isolating a COVID positive person, do you think that it just won't serve any purpose anymore, because as large sections of the population have caught this virus at some point in time, so nothing can be made mandatory now. If you impose a fine of say 500 rupees if you don't wear a mask, not going to work, not going to help. Perhaps people can self realize that what is good and what is bad, how to save themselves, like they do for other diseases.
Yeah, I think we are talking about two separate angles of the problem here. First, I will
Yeah.
start with mandate. I have
Yeah.
consistently and vehemently spoken against mandates of all kinds from the
Hmm.
beginning of the pandemic. In fact, in all
Hmm.
of my lectures and articles, I've never asked people to get vaccinated. So it's our transparency in our communication and our sincerity that the public embraced. And they, in fact, went ahead and took the vaccine, knowing the studies that we have come out with. We did the first study on vaccine safety in India from IMA, from Indian Medical Association. And that study was quoted all around India. That showed people that the healthcare workers who took the vaccine first, they did not exactly drop dead after taking the vaccine. So that is all our public needed. They got an assurance that the healthcare workers are all lining up to take the vaccine. They all seem fine. And Dr. Rajeev and co have published a paper on around 5,397 people who took the vaccine and they seemed fine. Of course, we reported the side effects such as fever, body pain, headache, loss of days' work. All of that was very transparently communicated to the public, and the public embraced it. See, that is what I mean by transparency. There is no need to force anyone to wear a mask or to take a vaccine. That's my opinion. It's my personal opinion. Now, as far as masking goes, I'll point out a slight difference here. I work with road safety. I'll give you a parallel on road safety, because road accidents kill a lot of people in India, and I got involved with that about 8 years ago to prevent road accidents. So in the part of India I live in, the rule of helmets came in, and people started wearing helmets not because of awareness, but because there was a penalty. They did not want to be stopped by police and to be given a bill or fine to be paid, without which their license could potentially be suspended. So that was initially viewed as a harassment, but now we are enjoying, we are reaping the benefits of that penalty. The rate of head injuries has plummeted to, you can see neurosurgery operation theaters that were running around the clock are literally ran empty, because that is the effectiveness of these interventions. And that did not come by awareness building. It came through penalty. Now, I'm not endorsing penalty here, but I would like to take a different view on penalties. Penalty in many ways is a form of communication. The lay public looks at certain things and says, is there a penalty if I don't do it? It's like income tax. Income tax, most people pay because they'll be penalized if they don't pay the tax. You try making it voluntary. You tell me the number of people that are going to pay income tax. I don't think many people are going to pay it if my instincts are right. So rather than as a harassment, I think a penalty is to be seen as a statement or a signal or a message to the community. That's the way I see it. So mask mandate, I won't say that we use mandate. I'll just say, when there's a spike of cases, it's safer to wear a mask, especially indoors, and especially so if you're around vulnerable people. I think that's common sense, but I think a penalty will help enhance that behavior.
But people should make up their mind. They should make conscious choices. When the infection is spreading, they should take care. They should wear masks and they should take care of the elderly people. But the focus should be on other things also, testing and vaccinations, given the fact that vaccines have protection only for a stipulated amount of time. So those are things that need to be focused on. But that brings us to the end of our discussion. Thanks to all our panelists for joining us today. That's all we have in today's show. Thanks for watching.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.